As Michelle said, my name is Milton Foster. I'm the Senior Vice President of Potomac Companies, which is the insurance brokerage firm that partners with Unity Healthcare administering your benefits. Today we're going to go through the RX Management Seminar, where we will answer questions and give you information that will allow you to be able to take control of your healthcare and healthcare cost. So as a quick recap, what we would like to do is we would like to start off by looking at the meeting agenda. And the agenda, of course, would be the first opening statement, which I've just given you. We will go over the CareFirst and Kaiser resources overview. We're going to talk about prescription management, understanding your plan, brand versus generic comparison. We're going to go over a roadmap to savings, which will assist you in doing prescription searches, discount options, and advocacy programs that are available to you as a CareFirst or Kaiser member, the mobile apps, the various pharmacies that participate with these vendors that I will be reviewing with you, and then at the end we will close it and then have a Q&A session. So now let's just do a recap of why we're doing this. We're doing this to take control of your health. Empowering you to become an educated consumer for healthcare is an important role not only for you as a consumer, but for Unity Healthcare as an organization. Everything that you and your family members do has a direct impact on Unity as well as your colleagues. So every time you actually utilize your medical plan, you will notice that over the course of the years, your rates have slightly increased. That is due to utilization. So this presentation is to help you be accountable for your health and well-being and provide the tools to do so. We are raising awareness about common health issues and support you in being well. We're trying to build a culture of well-being that everyone can own and recognize, and most importantly, we're doing it to help you save money. You may or may not know healthcare is one of the highest expenses for Unity, and it goes up every year. Yes, because you see these 20 and 30% rate increases, that is based on the utilization, and it, again, has a direct impact on Unity Health Plan or healthcare. You, as a consumer, have the power to take control of costs by working towards positive health results, which will keep premiums low. Now we're going to review some of the CareFirst and Kaiser resources. And this is just a brief overview. So let's take a closer look. Everyone who is on the CareFirst plan should have registered under My Account. And once you've registered, you will have set up your own ID and your security questions. Once you're inside of My Account, you will be able to review the status of your claims, view your benefits, determine your out-of-pocket cost. This website also provides quick access to prescription drug information, health and wellness information, and it also contains the link to your benefit wallet account, which is where your health savings account money is kept. If you have not registered, please visit www.carefirst.com. Once you have registered, you will notice that you will be then taken to a registration page, or should I say if you have not registered, you will be taken to a registration page where you must put in your member ID number as well as your date of birth. You will then be required to set up 5 security questions. Please make note of those questions as they do switch around in their order, and it may not be the way that you remembered it as you put the information in. Once you're registered, you will then be taken to your personal dashboard. The personal dashboard is a place where it shows you your copays, your member ID number, it shows you your group number, it shows you where you are with your deductible and then meeting your deductible, as well as it shows and tracks your out-of-pocket cost. You will notice on the right side of the screen there is a Quick Links toolbar. And from there, under Quick Links, it has a link to your Blue Rewards, the Health Assessment and Online Coaching, Blue Fund Administration, which is where your HSA money is kept, Treatment Cost Estimator, You will be able to search your explanation of benefits, also known as EOBs. You can look up drug and pharmacy information, as well as you can select and change your primary care physician. I would like to make note that you can change your primary care physician at least once a month. However, should you do so, you will get a new ID card listing each time with the new provider's information. The treatment cost estimator is a tool that is available to you. Say, for instance, if you should need some type of upcoming surgery or a procedure, you can actually go to the treatment cost estimator tool and you can actually put in the name of the procedure and it will tell you exactly how much it's going to cost based on a radius search. Say, for instance, if you put in zip code 2002, it will tell you what it's going to cost you at Shady Grove Hospital, Washington Hospital Center, Georgetown, GW, etc. This is what the actual results will look like. You will notice this search that I did was an MRI of the abdomen, and the cost ranged from $589 at Progressive MRI on the right side of your screen, third one down, to $651. However, if you were to go to Georgetown MedStar Medical Center, your cost would be $1,247 or between $1,247 and $1,379. Why do you care? As you all know, if you're on the high deductible plan, you are paying the negotiated cost of those services until you actually reach your deductible. Once you reach your deductible, then you will start paying the various copays associated with the various procedures. So I would rather, as a consumer, spend $589 as opposed to $1,247 for the same exact MRI that's going to have the same exact results. It just all depends on the location of where you actually had those procedures done. You can do the same thing for prescription drug benefits. You can put in the name of the prescription and the dosage, and it will tell you exactly how much it's going to cost you at CVS, Walmart, Rite Aid, Giant, Safeway, etc. I will give you an example. I am on Advair for asthma. It is a seasonal asthma. However, when I go and get my Advair at the CVS, which also is housed in the same exact parking lot as Giant Food, at CVS, it will cost me $275, whereas at Giant, it's going to cost me $450. The moral of the story is, do your research, and I saved $175 just because I was an educated consumer and looked up what the actual cost of the medication was. Now let's talk about Kaiser Permanente. I will play a short video, and then we'll be back to you after the video has played.
Hi, I'm a new Kaiser Permanente member, just like you. It's been a great choice for me, especially now that I've signed up to manage my health on kp.org. I was able to choose a doctor, transfer prescriptions, and get care for me and my family. It's really helped us get the most out of our membership. Let me show you how. As soon as my coverage began, the most important thing I did was choose my doctor. It was really easy and actually kind of fun. I went to kp.org/newmember, clicked on Choose a Doctor, and from there I was able to browse doctor profiles, see what languages they speak, their education, and what their interests are. KP has a world-class selection of top doctors, so I was able to find and choose the right doctor for everyone in the family, even for my husband who thinks he doesn't need one right now. Plus, we can always change our doctors anytime we want, for any reason. After choosing my doctor, I went to kp.org/newmember, clicked on the Register on kp.org button, and filled in some basic information. It took just minutes, and now I can securely email my doctor's office, refill most prescriptions, schedule routine appointments, and lots more. And thanks to KP's Ask for a Family Member service, I can manage my family's health needs, both at home or on the go, using my KP mobile app. Getting prescriptions with Kaiser Permanente is so easy. I just clicked on Get Prescription, and all the info I needed was right there. I followed a few simple steps, and KP took care of the rest. Now I can order most refills online and pick them up at the pharmacy or have them mailed to me at no extra charge. As new Kaiser Permanente members, we began getting the care we needed right away. My mother, who is also a member, had a fall soon after we joined. We called a 24/7 advice nurse who was so helpful. It's good to know KP is there for us when we need them. So whether it's the little things like scheduling routine appointments or something more serious like emergency care, Kaiser Permanente fits into our life wherever we are, online, on the phone, on our schedule. Remember, go to kp.org/new member to sign up and start your healthy journey.
So now we have a quiz that now that we've reviewed the actual Kaiser Permanente video, and this will make you actually put on your thinking caps. Which of these is the highest example of an actual price increase that has occurred recently? A, 50%, B, 200%, or C, 800%? The correct answer is C. If you all recall, just recently we had the EpiPen situation where the EpiPen was ranging anywhere from $75 up to as high as $600. That is a great example of how the inflation cost of medications can affect you and your family members. So the next question, what are the names of the 4 prescription tiers that Unity Healthcare has? The first is generic. The second is preferred brand. The third is non-preferred brand. And the fourth is specialty and self-administered injectable medications. So yes, generic medication is going to be the least expensive, whereas your non-preferred brand is going to be the most expensive medication. You also have what is called specialty self-administered injectables, whereas in the past, it used to be 50% up to no cap. Now, with the 2017 plan design, it is 50% up to $150. So there is a cap on the actual cost of that medication. Understanding your prescription program is very important because this is a way that you can actually save money. There are several ways that you can actually take advantage of these savings. First and foremost is generic medications. As I mentioned a moment ago, it's usually your least expensive option. You can also get retail 90-day prescription at your local pharmacy. There is a caveat that your physician must write the prescription for a 90-day supply instead of a 30-day and 2 refills. You can also take advantage of the mail order program. It's a 90-day supply of medication and you only pay 2 copays. Another way to save money is by taking advantage of the pill splitting program. Under the pill splitting program, your physician would write the prescription for 2 times the strength, and you split the tablet and take the recommended dosage per your provider. Now, please keep in mind, not all medication is suitable for splitting. Like, for instance, you cannot split capsules, you cannot split time-release medications, etc. You can't split narcotics. You can't split birth control. But there are medications that you can actually split and take advantage of the additional savings. So I'll give you an example. Your physician wants you to take a blood pressure medication at 10 milligrams per day for the next year. The conversation you should have with your provider's office is if they could write the prescription for 20 milligrams. Because what you're going to do, you're going to take the prescribed milligrams of 10 per day, but you've now taken that 90-day prescription and you've extended it to 6 months. So therefore, you've not only saved the initial copay of 1, you've saved an additional 2 copays just by having that conversation with your provider's office. Now again, not all medication can be split. And again, it is a conversation that you should have with your provider's office if you're on maintenance medications. You can also take advantage of the OTC or over-the-counter substitution program. Some prescriptions have OTC alternatives. Check with your doctor or your pharmacy. A lot of times when you actually visit the pharmacy, they will normally have a sign that says, talk to me about generic medications or OTC substitutions. Have that conversation because that's a great way to additionally save money. So I just want to stop here one second, and I do want to continue to say there are no exceptions of changing your prescriptions without having a conversation with your provider's office. Now, let's look at your prescription drug benefit. Generic prescriptions fall under Tier 1 of Unity's plan for both Kaiser and CareFirst, resulting in your lowest cost. Members enrolled in the Kaiser plan will pay a $10 copay for generic. CareFirst members will pay up to a $15 copay for generic prescriptions after you have met your deductible. So here's some examples of some true costs of what medications look like. Let's look at Zoloft for an example. Under the brand name category, Zoloft at 50 milligrams for a 30-day prescription is $265.72. That is prior to you meeting your deductible. Once you have met your deductible, if you're on the CareFirst plan, you will pay a $60 copay for a 30-day prescription. Under the Kaiser plan, you will pay a $50 copay. However, there is a generic equivalent, Sertraline HCl. On the CareFirst plan, prior to the deductible, you will pay $2.04. Under the CareFirst plan, after you have met the deductible, you will notice that the generic medication is still $2.04. You will never pay more than the cost of the medication. So even though you have a $15 copay under CareFirst for generic medication, you will never pay more than the cost of the medication. And if you're on Kaiser, you will pay the $10 copay. Let's look at Crestor. Crestor is $260 for a 30-day prescription prior to the deductible. Once you have met your deductible, it's $35 under CareFirst, $30 under Kaiser. Simvastatin is the actual generic equivalent for Crestor, $32.58 prior to your deductible, or $15 on CareFirst and $10 on Kaiser. So as you can see, just with those two examples, there are significant savings just by having a conversation with your provider's office, as well as utilizing the CareFirst tools that are available to you to actually look up the cost of medications. Now let's look at some ways to find additional savings. RX searches. There is a company called GoodRx where you can actually compare prices by doing a geographical search. You can print coupons, as well as this is a program that you can actually save up to 80% of the medications. So here's an example. Gabapentin, 300 milligrams. There is a generic Neurontin, and if you look at the various costs within a 10 to 15 block radius search, you have an array of different costs ranging from $13.53 up to $49.19. So again, this is a tool that is available to you outside of the CareFirst website that you can actually find even greater savings. The next, Blink Health. You will notice on the very bottom, Propecia as a generic medication, the normal cost is $73.39. By using this program, you would spend $19.96. That is a 73% savings off of the actual cost of that medication by going through Blink Health. Here's another one, LoisMeds.com. Lois Meds, again, you put in the name of the medication, you find your price, you print the coupon, you give it to the pharmacist, and you save an additional amount of money. Discount options. There are discount cards that are also available to you. The Better RX card, where it will allow you additional savings. You do need to register. You then print your drug card and you use it at the pharmacy. The Discount Drug Network, where you can save up to 85% off of medications. Again, you would need to register, print your card, and it will tell you where those pharmacies or what pharmacies actually participate with the program. Then there's RX Savings Plus. Again, print the card. You do need to register, print the card, and you can start saving. And then if you're over the age of 50 and you are a member of AARP, they also have discount programs as well. So again, there's a number of resources that are available to you, to include the Easy Drug Card that's actually recognized at Costco, CVS, Walmart, Walgreens, Giant, Kmart, etc. Say, for instance, if you have a medication that the carrier doesn't cover and you can't get the carrier to pay for it, there's an advocacy program out here where you can actually sign up and they will advocate on your behalf with your insurance company and your doctor's office to try and find you affordable medications or a medication that is potentially not covered under your medical plan. Again, in this situation, you would need to register. Once registered, you would then have access to the advocacy program, and they would be able to begin advocating on your behalf. Mobile apps. GoodRx Search or SearchRx is a good mobile app to use, but then you also, as a CareFirst member, and once you've signed up for my account, you have the ability to actually download the mobile app onto your smartphone. Everything that I just went over with you, you can actually do directly on your CareFirst mobile app. And if you're a Kaiser Permanente member, they too have a mobile app as well, and you can actually register, download the mobile app, and start utilizing it. The pharmacies that participate with these vendors are over 63,000, to include Rite Aid, CVS, Walmart, Rite Aid, Safeway, Giant, Kmart, Target, Kroger, etc. So there should be no reason why you should not be able to find a pharmacy that is going to participate and give you the greatest savings utilizing either your CareFirst plan or one of the discount programs that I just showed you. The last page is the prescription vendor contact information. I've given you the 3 vendors that I just went over for RX Search. I've given you the 5 vendors that I went over for RX Discount Card, the advocacy program, as well as the mobile apps that are available to you. As you are aware, this information has already been sent out to you in a PDF format, so you should have copies of not only the link, but also the contact information. Questions? And this will end my portion, and I know Michelle will now open the lines up and we can start answering any questions that you might have. I'd like to thank you all for taking the time to listen to the presentation, and we'll open up for questions at this point.
Milton, we have a question. Does HSA dollars cover over-the-counter medication options?
For over-the-counter medications, you would need to have a prescription written by your provider, and it will cover it based on because you've had a prescription. Any other questions?
Feel free to type up your questions if you do have questions. We have a question. I use Rite Aid and could only purchase half of my prescription due to cost. If I use coupons or savings, can I get reimbursed?
Yes, if you use the coupons for savings and you have spent out of pocket, you can go online and reimburse yourself through my account.
Can you buy over-the-counter medication with the discount card?
It depends on the discount card program that you sign up for, and if it's a part of that program, then the answer would be yes, but that would be pharmacy specific.
How much is the deductible?
Your deductible for an individual is $1,500, and if you're a two-party or more, that's an employee and spouse, employee and child or children, or a family, which is two adults, be it a domestic partner or spouse, and one or more children, it is $3,000. Are there any other questions?
No, there are no other questions.
Okay, guys.
All right.
You know we get to this point when we say there are no more questions, and then you send about 10 more questions as someone just sent another question. What's the last question, Elizabeth? Nothing? Okay. Milton, you want to conclude?
Yes. Well, on behalf of Potomac Companies, we'd like to thank you all for taking the time to listen to this presentation. Your benefit resources are, as noted on the screen, is your benefits team, Elizabeth Martinez, Michelle Otley, and Alicia Arthur. You also have the Potomac team, which is Sarah, John, myself, as well as Joe Applebaum, president of Potomac Companies. I would like to mention that we work for Unity Healthcare. We do not work for CareFirst or any other insurance company, CareFirst, Kaiser, etc. So if you have a question or you need anything from the team, please reach out to us at benefits2@unityhealthcare.org, or you can always send to the green team at potomacco.com, and we will be happy to assist you.
Thank you, everyone, for attending today's presentation. There will be a post-test sent within 24 hours of today's presentation. You also have a copy of the PDF, which is attached to today's webinar. We will send it out again when we send out the link to the post-test. You have 24 hours after you receive the test to complete it, submit it in order to receive the credit. Don't forget, your preferred rate deadline is March 31, 2017. We will have additional presentations in March, which you can attend, and we will also have our financial fitness, which kicks off in March as well. If you have questions, don't hesitate to email us at benefits2@unityhealthcare.org. Again, thank you from your HR benefits team as well as your HR broker. Enjoy the rest of your day. Thanks, Milton.
Thank you, ladies.
Bye, Milton.
Bye-bye.